And over 30 years ago, out of a response of the needs of this community, the Brown schools first broke ground right across the street with some of these very shovels. In 1987, San Antonio was in desperate need of high quality, evidence-based, best practice residential treatment for children and adolescents. And so Laurel Ridge Hospital was created and began treating children and adolescents. It wasn't long after that, very soon, the obvious need for the treatment of adults struggling with addiction and mental health issues came to the forefront. So Laurel Ridge, we expanded to Laurel Ridge Treatment Center in that 20 acres across the street from here. And so as the needs of the community grew, so did we, including our scope of specialty services that we provide. Our patients, they needed a physical way to work through their emotional and mental barriers. So we developed a ropes course. Our patients needed a way to express and process through their trauma. So we developed our extensive art therapy programs. We're always seeking to meet the need of our patients and of this community. There's so many examples I can provide, but let me provide one of such a specialty program. As we know, following 9/11, it became evident that the war on terror, it wouldn't be a short battle, but rather a long engagement involving multiple deployments and tours of duty for service members who'd experienced major physical, mental, and psychological traumas. We saw more and more service members who were surviving due to the improved armor and various reasons. Laurel Ridge began to understand that the military would need someone to come alongside and support those servicemen and women who served our country. It became clear that the sheer numbers of soldiers returning with combat-related PTSD, trauma, and war-related mental health issues would quickly outpace the military's capacity to treat them all. So as we have always done in this community, we began to listen. We began right here, as the chief said, in Military City, USA, to listen to the needs of command, chaplains, military physicians, and clinicians of what they were seeing as soldiers return from duty. I can say we listened well. And out of the needs expressed, mission resiliency was born. Very soon, we saw the need for a dedicated military cohort, building and program that was tailor-made for those who had lived through such a unique battle experience. So we built our 60-bed mission resiliency program. That building and that team have served this country and our hospital well, caring for U.S. service members as close as Fort Sam, Lackland, Randolph, and as far away as Germany. And last week, I think we saw Vicenza, Italy, to Tripler, Hawaii. It's all over the globe. So over the last 3 decades, Laurel Ridge has time and time again responded to our community's greater needs, broadening our scope of specialty services, offering a full continuum of care for ages 4 on up to as old as people get. Like the military, following the effects of living in a post-Columbine, post-Parkland world, Laurel Ridge focused on the emotional well-being of students. We grew to currently providing 13 inpatient specialty programs, 7 outpatient programs, and various advanced therapeutics, including ECT and TMS delivery. So once again, here we are, responding to the needs of our community. We break ground to further extend our commitment to the people of San Antonio and Greater Texas, and to the U.S. service members all over the globe. We're proud to begin construction of this 80-bed medical center that will house missions for active duty veterans and first responders, but also allow us to extend our overall footprint to over 330 behavioral health specialty beds, which will also allow us to further grow our programming and focus more deeply on all services, including those for children, adolescents, and adults across San Antonio by offering these various programs, including Beyond Our Mission Resiliency expansion, trauma programs for children, advanced mood disorder programs for adults living with suffering from depression, women's only program, addiction programs to combat the devastating effects that we're seeing from the opiate epidemic. I can tell you what, there's more to come from this team. They're so committed to this community. I can assure you that this is just our beginning as we continue to save lives, heal families, and create hope. So thank you for coming out here today. If I can have our designees join me as we break ground. Thank you.